Hello and welcome to our webinar. I'm Dr. Howard Gluss. I'm a licensed clinical psychologist here in Beverly Hills, and I'm very excited to present the fourth in our series of webinars on binge eating and obesity. And we're very excited. I'm with the Kalili Center. We're a multidisciplinary surgical center and bariatric center. We're here in Beverly Hills, California. And we've had a series of these webinars, and I want to introduce the fourth in our webinar. I want to tell everyone that that we're very excited to present this webinar, and that our fourth series, we're just having one little technical difficulty. Let me just deal with it before we get into it. The screen. So actually, I apologize for that and a bit of the disconnect, but we're having a little bit of technical difficulties. We're able to fix it. So now we'll get on with our webinar. As I said, I'm Dr. Howard Gluss here with the Kalili Center in Beverly Hills. We're going to talk today, we're going to explore the concept of binge eating and obesity. And when I was thinking about how to present this, I started to do some research, and I came across a statistic that I found so interesting. It was such a simple statistic, but it was the fact that binge eating disorder, which is known as BED, B-E-D, is the most prevalent eating disorder in the United States. And I was kind of surprised to find out about that and a little bit shocked. And I started to think about it in the way I like to think about things from a metaphorical standpoint as a clinical psychologist is, why was, and this is just based on my clinical observations, not necessarily based on any research I read, but why was BED such a prevalent disorder in the United States? And when I started to think about it, I did think about how food, a lot of times to individuals, represents the sense of nourishment, the sense of wanting something inside of their body, something that they can feel good about, something that fills them up. So food can also represent things like love and attachment and connection. And I thought, maybe this is the issue, that one of the issues, and again, there's so many ways of looking at this. This is just one perspective from an attachment theory, but are we not attaching enough to individuals? Are we not connecting enough to people? Are we not being fed enough by our environment that can make us feel full? And I thought that, the issue of attachment a lot of times for people who are obese is there is this paradox that goes on. They many times feel this desperate need for attachment, but at the same time, when they have this connection, they get terrified of it. So at one point, they're desiring it because they feel empty, so they want the food inside of them. And if they're feeling it to a great extent and a lot of anxiety is taking them over, they might have this sense of binging and wanting to get full quickly. And then once they get it, there is this sense of danger, that maybe the attachment is dangerous, especially if you come from a background of abuse. And so there's this pushback, there's this need to separate from the attachment, from the person you're trying to connect to or the experience you're trying to connect to. Somewhat of a love-hate experience, because both sides create a tremendous amount of anxiety. And that's the way I like to look at it, is when we're working with people who have an eating disorder, especially around binge eating, one of the issues we're looking at a lot of times is the issue of attachment, the issue of helping someone connect. A lot of times it's through the therapist, and then helping them expand and separate without feeling a sense of abandonment or without feeling a sense of fear or a sense of retaliation. So it's like working out physically. I like to use that analogy for patients, that it's not that you just get an intellectual understanding of it. It's like getting an exercise program. You have to work the program over and over again and get stronger and understand all the subtleties. That's how I like to work psychologically too, to be able to do that and keep working that experience. So that was something I wanted people to think about and maybe write to me about what they felt about that concept of how binge eating, and I will get on a little bit later in the webinar, I will get on to what the exact definition is of binge eating, but the concept I wanted to explore first before we went into a DSM-5 diagnosis of it was that it's metaphoric. It's a need to feel full, and sometimes it's a need to feel full very quickly because someone is experiencing a great amount of anxiety. Two illustrations of this. I was thinking about a client I work with for a very long time now, and he made a great statement. I'm going to read it. He said, "One little embrace sets off a firestorm." And what he meant by that is, this is a gentleman who had unfortunately had a lot of abuse growing up, and actually some sexual abuse growing up. And it was something that a lot of men feel very ashamed about talking about, and difficult for them to open up about because of issues it brings up for them about their masculinity or depression, or feeling like maybe they were to blame in the experience, because there could have been a lot of confusion around it. And again, this is a guy who struggles a lot with binge eating disorder and struggles a lot with obesity. And he said, you know, I feel so lonely inside. And when I want to connect to someone, when I want to feel them, I try to go out on dates. And the moment I feel like I have some success in the date, that's what he meant by that statement. All the past trauma starts to come up, all of the anxiety, all of the low self-esteem, and he just gets flooded with this experience that feels so disturbing to him that he doesn't really know what to do, and he gets into this manic state, and he tries to then fill himself up with food, which ends up in some sort of state of binge eating. So he's in a rock and a hard place constantly, and that is what our work has been about, is trying to get him out of that place, to get him strong enough to be able to tolerate some of the anxiety and depend less on issues of obsession and compulsion and issues of anxiety, and help him tolerate some of his anxiety. So he understood that food was about shame for him, that even though, and this is what I mean by that, when he would eat, he would feel so ashamed that he succumbed to the binging, that he would experience such low self-esteem around it. So he was constantly in this very difficult place of feeling terrified and wanting to get connected, and feeling terrified and wanting to get connected. And the way he seemed to deal with it was through binge eating, which was in some ways a type of addiction. It has a lot of addictive qualities. Not formally an addiction, but a lot of addictive qualities. What's interesting also I wanted to mention as we talk about it is who I would become in his world. When I first started to see him, he was so anxious about coming into the office that many of the sessions had to be done over the phone. And this was a way to slowly allow him to feel that I was a safe person, that I was someone he could connect to, and I was someone who was not going to try to injure him like people have abused him in the past. So it took us a while to get him to the place to even tolerate, to be able to come into the office and to be able to experience himself with me in the room and understand that I wasn't a person who was going to try to attack him. That's how devastating the abuse was for him. And he also stated that a lot of times after he would talk to me is when he would go and binge, that it would create a lot of anxiety. So it was this very delicate dance around how to help him get stronger, just like someone would get stronger physically, get him stronger mentally, but not overwhelm him to the point that he would feel like he needed to abuse himself. So the question I'm asked a lot of times is, at what speed should I go, Dr. Gluss, with my own recovery? And the answer I want to give is whatever speed is right is what works for you. That there is no specific way of doing it. You have to work with a time that in some ways, and I know everyone wants it really quickly, but time is not the big issue here. The big issue is getting you stronger, and it'll take as long as it'll take. And it'll always feel like it'll be longer than it was, but when you look at a history of abuse or a history of binge eating, you can see that the treatment is actually pretty short compared to the history. So, previously the DSM, which is the Diagnostics and Statistical Manual of Mental Health, the DSM-4 listed binge eating as a subcategory of eating disorder, NOS, but now in DSM-5, which is the latest version that we're dealing with, it is officially now considered eating disorder. And three of the characteristics that one must have in order to be diagnosed with binge eating, and then there are several others that I will talk about, is it has to be a discrete period of time that one is binging. For instance, maybe a 2-hour period where someone can't stop eating. It's not a constant grazing of food, but it's almost like a PTSD type of attack. It's usually strong and within a certain time period to get that formal diagnosis. One usually also in that time period is going to be eating much larger portions than one usually eats, or much larger portions that then will satiate you. So the size of the portion has something to do with it too, the period of time, and also the sense of lack of control. That during that period of time when you're binging and you're eating large portions, there's a sense of compulsivity, that you don't have control over the experience. So that's what will give someone, the beginnings of a formal diagnosis of binge eating disorder. Some other things to consider, and usually when we have these disorders, there are different categories, and it may be, for instance, you need 3 out of these 5 symptoms, etc. But I want to just sort of generalize for our purposes what things you might look for if you feel like you may be suffering from binge eating disorder. Additional things are that, as I said, you eat rapidly, so you're eating really quickly. You usually eat to a period where you feel uncomfortably full, that there isn't a sense of feeling satiated. And maybe as that fullness starts to leave you, you return to the binging and want to feel completely full all the time. So metaphorically, that is this experience that the sense of emptiness is very difficult for you to deal with, and so you want to always stay in this full state. It's like someone who may be high for a moment and wants to stay in a drug-induced state of being intoxicated or being very high. The moment you start to lose that high, you want to do more drugs or drink more to get back to that place. Another interesting characteristic is the sense that you might want to eat alone. I have actually seen this several times. I saw this through a friend of mine who had a problem with binge eating, and I remember when we used to get together, this was when she also had a problem with obesity, and we were studying for our exams together when I was studying to be a psychologist, and we would meet at these food court, and I was always struck with the sense that here was this very large woman, and she would never really eat when I was eating, just have very small portions, and she would say she was always full. And one day after we finished studying, I went up to the second floor of this mall, and I noticed that she was downstairs, and we had completed studying, and she had gone and she had ordered all this food, and she was eating by herself. And I sensed that there was as I looked at her, a sense of being out of control with her eating. And I thought, wow, there's such an experience of feeling shame about what she was going through, that she felt so embarrassed, but yet at times she felt like she couldn't control herself, but would wait till I left so she could, eat large amount of foods basically on her own. And ultimately, when I thought about it, I felt very sad for her, because I felt like she's carrying so much of this burden by herself, which a lot of people are who have this disorder. And I want to, early on in this webinar, encourage you that if this is something you're dealing with in your life, there are so many professionals out there that can help you deal with this issue, that there's no need to suffer by yourself. So as I mentioned by this illustration, shame is a big issue. There's also the sense that people tend to do it, let's say more often than not in a period of time. So something like 1 time per week over a 3-month period. So there is some sort of time element involved with it too. It may not just be a one-time issue. It's something that may happen over a period of time. Someone keeps going back to this way of dealing with some of their issues. Now, in this webinar, we're exploring just a small element of the psychological component of binge eating, but research has also shown that there's a strong biological component, which I'm not going to cover here, but that definitely accounts for some of the disorder. And even psychologically, there's a vast array of theories and ways of understanding binge order. I'm just going to present one specific way that is connected for me as someone who works in weight loss quite often and works more psychodynamically, which is a type of psychology. There usually is also not, there's non-compensatory behaviors. So in other words, what that means is binge eating is usually not associated with things like purging or bulimia. It's something completely separate. So if someone is purging, the official diagnosis might be different. It might be something like bulimia, for instance. And also, a lot of times to accommodate the binge eating, there may be strong lifestyle changes. So in other words, someone who maybe has a lot of shame around their binge eating episodes, they may not socialize a lot. They may not go to restaurants because they don't want to be around people. Or they may go to restaurants by themselves in order to not deal with the shame of binging. Or they may people miss work, or they don't go to family events, or they don't, they don't do a lot of things that maybe, they don't go out and go to movies because they would rather, not rather, but there is a sense of they need to change their schedule around in order to accommodate the binge eating episodes. So that sort of takes care of the concept of how binge eating can formally be diagnosed. And as I was doing some research in this, I started to talk about a group that, to a group that I have at the Kalili Center. As I mentioned, I work with the Kalili Center. It's a bariatric and multidisciplinary center in Beverly Hills, California. And we have a support group for patients who have been through bariatric surgery or are contemplating the surgery. It's open to the public, it's free of charge, and sometimes patients who are dealing with weight issues who aren't necessarily considering the surgery come to us. And so we're open to really being of service to everyone in the community. And as I was doing some research, I presented a few statements to my group that were very interesting to me and have the reaction. And I thought, as I treat binge eating disorder in my private practice, these were 3 attributes and statements that came out that were very powerful to me in what I experienced with patients. And I wanted to share them directly with everyone on this webinar. So I'm going to read the first one. And it says that it's from an article that's from the Latin American Fundamental Psychopathology Society. And it says that the first thought is this: prejudice against obesity is one of the most socially validated types of discrimination. Even among medical doctors, there is anecdotal compassion towards anorexic patients, and more often than not, an aversion to obese patients. Obesity is often associated with moral weakness and lack of willpower, and even with shamelessness. And when I shared this quote with my group, and we talked about how this also connects to the sense of binge eating, I could sense there was this deep connection that people felt. And one of the things they said many times is that doctors always felt that their binge eating that may be associated with their obesity, that usually was associated with one of the contributing factors, was something that they could do and control, that it wasn't a disorder, that it was just a lack of willpower, and they should just eat less and go on a diet and would just minimize them and minimize the whole situation. And several patients mentioned that when they had this experience, they actually felt worse, and it activated their binge eating because it created a lot of shamefulness. So in this section that I'm talking about now around how do we deal with this issue, one of the first things is we have to not allow people to feel shame about their experience, because that's only going to make it worse. And one of my patients said something that was very touching. She said, I just wanted to feel like someone heard me for who I was. They recognized me and recognized that as a large person, I've been struggling with this issue my whole life. And I heard that very specifically, that the empathy was something that was so powerful, that giving her an experience where someone could just say, I hear you, I get you, I know you're struggling with this, maybe I can be there to help you. That alone, giving someone the space in a non-judgmental way, was so powerful. So that's what this quote meant to me is, we do, not everyone obviously, but there is this sense of sometimes people who have weight issues are just, they just don't have the willpower. They just should know better. And this is not an issue of willpower. Well, it is a little bit, but it's also more than anything an issue of there's a complex dynamic going on, and we have to peel away at it and recognize all the different levels of the complexity and start working at it, like putting a puzzle together or deconstructing a puzzle, that we have to actually respect that complexity and not oversimplify it. So that was something that was very powerful for me in the treatment of binge eating, was this sense that that statement said to me that we have to not keep encouraging a sense of shame in people who are suffering or struggling with issues of binge eating disorder. Another way of thinking about it is when you're thinking about your own issues around eating and what you're trying to accomplish, you may start to get out of this concrete place of food and get into more of a symbolic, metaphorical explanation of what's going on. I definitely think there are physiological things that cause us to crave fat, sugar, and salt, but there also is an element of psychological issues that may come up. So start thinking in metaphorical terms when you're dealing with your with some of your struggles, that what is the meaning behind the food? Is it a way for you to deal with emptiness? It is a way for you to deal with a way to connect to people? Is it a way for you to get approval? Some people come from cultures that encourage a lot of people to eat great amounts. There was a patient in our group, I thought it was such an interesting statement. He was going for obesity, for weight loss surgery, and he said he was terrified. He came from an Italian background, and he was terrified of telling his family that he wouldn't be able to eat pasta anymore, that they would think that that's a personal insult, and they would take it as them not respecting him, not respecting them. That's the deepness of the connection. So it wasn't just about pasta, it was all the meaning behind it for him and his family. And actually, we did talk about it, that maybe eventually some people, not often, but some people may be able to eat a little bit of pasta. Some people have shared that. But the most important thing for him was he needed to articulate where he was coming from, and he needed to not be afraid to repeat himself several times over to tell people that this wasn't a personal thing, but this was an issue he was struggling with, so they could depersonalize it as an insult against them. So when we're thinking about food and we're thinking about binging, one of the ways to stop this kind of dissociative compulsive behavior is to get mindful. Mindful means thinking before, to me, this isn't a formal diagnosis, but the sense of just always being conscious about something, always thinking about our actions. And actually, one of my patients said, I'm so tired of being mindful. Sometimes I just want to give myself a break. And I said, well, then can you give yourself a break in a very specific time and say, you know what, this one meal, it's a holiday meal. She was talking about Christmas. Holiday meal coming up, Christmas, etc. I said, well, you know what about if you just said to yourself, I'm not going to worry about it too much this meal. I'm going to give myself permission to maybe have some of the foods I don't usually have, but then I'm going to get back to my program. And that actually helped her because it helped to minimize some of the sense of shame she may feel about the experience, that she always had to have it right and she always had to have it perfect, that sometimes she could let loose a little bit, but it was very specific. And she also mentioned that there were certain trigger foods that she had that she knew she just couldn't go near, that these would cause her to go into a binging experience, just like somebody, again, who uses certain drugs should never go near it because it may cause them to just spiral into a world of abuse. Listening to me is such an important part of being a psychologist, and sometimes I have to admit I do get accused of not listening enough. Um, but listening from a sense of care and love, that people need to feel appreciated for who they are, especially if they come from a background of abuse, whether it's emotional, sexual, physical, where they were not treated in some ways with any kind of respect. And they were abused for who they are, and they were belittled. So giving them the sense of feeling respected can really heal a lot of pain. And I do want to say, when you're doing that, don't do it, if you're someone on the other side, let's say like a therapist, don't do it in an artificial way. You can usually find some way to connect to someone within yourself that feels genuine. So go for that genuine experience, because people that are with you are also hunting for some sort of genuine life experience. They want to have a real sense of themselves. And so you can model that experience and model it in a way that feels very authentic to yourself. Because when you listen and when you're dealing with binge eating, you want to minimize someone's experience, as I mentioned earlier on with my patient, who felt like as he got closer to people, he got terrified of being abandoned. You want to minimize an abandonment anxiety. That someone feels like, oh, they're going to be too big, or they're going to be too much of themselves, and they're not going to be accepted for who they are. And so they get terrified of the abandonment and they pull back. You want to find a way to allow them to be themselves as much as they can, because that's the experience they're going to need to start moving away from that compulsive like binge eating behavior. And you want to minimize any kind of failures someone's going to experience. Sometimes people say to me, well, give me a program and I want to reach specific goals. Sometimes that's okay, but I'm very cautious as what those goals are, because people tend to set up goals that are not that realistic, and that may give them a sense of failure. And with that sense of failure, again, it triggers a binge eating episode. So we're trying to minimize those triggers. So yes, set yourself up some goals, but give yourself some leeway in the experience of reaching those goals, because as you're moving towards those goals, things may come up that you didn't expect that may make it more complex to deal with things. So a sense of perseverance is so important in dealing with these issues, that in order to persevere, yes, you have to feel like you're having some success, but you have to just not feel like the success is, the big goal, like I'll never binge again, but the success is all the step it takes to get to that place. And then sometimes, in addition to that, you may want to find something that is a constructive use of that energy. So if you've experienced a lot of anxiety or going through a treatment program that's helping you deal with binge eating, maybe you can channel some of that anxiety into something more constructive, like literally exercise, or something very physical that will allow you to focus in another way. I mean, exercise can be great, or maybe take the class, because you get that sense of focus and it gets you out of your head and it stops you from thinking so much about what's going on. So what I wanted to cover today in the this binge eating episode was this, what I wanted to take away to be is for people to understand some of the symptoms that are involved in binge eating, but also start to meditate and start to explore some of the dynamics that go on, that a lot of times the binge eating episode is a result of emotional or psychological turmoil that's going on, and it's an acting out behavior. And in order to understand an acting out behavior, you may want to understand, or it would be very valuable to understand some of the dynamics that may take place when, that brought you to that place of binge eating. That's an approach that I like to use as a therapist, is to look at the underlying issues that may cause the acting out behaviors. If we deal with some of the root causes, then maybe we have a better chance of dealing with minimizing some of the binge eating behavior. I also would say that I'm very much in favor of developing alternative tools that might help you deal with binge eating behavior, like finding something constructive to do with that behavior, finding ways. Even a support system is wonderful that can help you stop that behavior. In OA, a lot of times in Overeaters Anonymous, the great value to some of my patients has been the fact that they get a sponsor. They have someone to be accountable, someone that will help them develop a strong structure. A lot of people work well within that. If you are that kind of person, as I've said before in these webinars, you can work both above the line, which is a more cognitive behavioral way, that's a term I like to use, and below the line, a more psychodynamic way, and working more with the unconscious. A marriage of both of them can be very effective for a lot of people dealing with binge eating disorder. So as we're talking here, there are a few questions I see that have come up, and I want to address them. And like I like to do, I like to pick about 3 that I think sort of encompasses things in a very profound but general way, and something that might be of value to some of our listeners and participants in the webinar. And I like to paraphrase them a bit, so I just focus on what the issue is. So there's a question here that says, there's a person, that's a good way to start. Her name is Gail, and she says that most of her life, she has been dealing with binge eating disorder, and she's wondering, most of her adult life, do I believe it's very behaviorally caused, or do I believe that she, as she says, she was just born this way? Well, I'm not an expert in sort of the physiological explanations or the genetic explanations of binge eating disorder, but one of the safe ways to go is to think that most of what we deal with from a psychological point of view has a component of nature and nurture. And what that means is nature is a sense of how we're born, that we may have a predisposition to binge eating, just like someone has a predisposition to, alcohol problems or being an alcoholic. And then nurture has a lot to do with what happened to us psychologically, the psychological components that came into play to be a binge eater. Now, if you do come from a family that tends to have obesity and binge eating in its background, you may want to focus a lot on the psychological component, because that may minimize some of the intensity of the experience and help you deal with it in a more constructive way. So if there is a predisposition to be that way, you should even be more mindful of your experience of being a binge eater. So you should even have a more awareness of what's going on for you psychologically to help counteract some of the physiological predispositions to being a binge eater. The next statement is from a person. Her name is Annette, and she said that she's been diagnosed with binge eating disorder, but she's also a recovering alcoholic. And she wondered, is there a connection between her alcoholism or her recovery from alcoholism and binge eating disorder? So I think the way to think about that is to look at it again, the some of the psychological components that play out in both of these disorders. With alcoholism, there is also a lot of times a strong sense of shame, a strong sense of depression, a strong sense of emptiness, rage, lots of psychological components that can come into play that can trigger an alcoholic episode. Deflation of your ego, etc. Well, if you think of binge eating, it could be a lot of those characteristics too. That many of those psychodynamic characteristics can come into play too. Guilt, shame, fear, anxiety, depression. So from that standpoint, I think they both represent a type of acting out behavior, and they both, according to research, have a biological component. So that's where I think it connects. So it's not surprising many times that somebody who suffers from one disorder, a lot of times, or one addiction, can have a co-addiction or get off of an addiction, like heal as an alcoholic, and transfer, that's what we call a transfer addiction, onto something else. So that's something to be aware of, that when you're going through the process of healing, that you want to be very conscious to not transfer that addiction or transfer it into some sort of acting out behavior. Again, if you're having problems with this, there's so much support out there from both support groups and therapists and places like we have at the Kalili Center, where we offer groups that can help you with this disorder. Or I don't want to use the word disorder. That can help you with this challenge. So yes, I feel from a psychodynamic, unconscious connection, there is a lot of similarities between the two of them. And there's another question, the last question I want to discuss that I thought was interesting, and a lot of them are very interesting, is the woman states that her husband is very supportive of her. It's a long question. And he doesn't believe that she really has a binge eating disorder. And even though she feels that he's really supportive, a lot of times he comes up to her and says, "Oh, honey, can't you just have a little bit more? It's not such a big deal. Just eat a little bit more. We're out with friends. Don't worry about your food." And what she asked me is, how does she deal with this with her husband? Because she feels that he puts her into a difficult situation. What came to mind right away when I read this was this sense of, if you were an alcoholic and you told someone you were an alcoholic, they wouldn't say, "Oh, you know what, just have," well, if they do, you need to reconsider that friend. "Oh, just have a little bit of wine. It's not such a big deal." So they're sabotaging your sobriety. That's a way to think of binge eating, and the sense of somebody who says that needs to get conscious over the fact that, unlike maybe some other people, this is an issue for you, and there are trigger foods, and you want to get, you don't want to go unconscious about your eating, that to them it may not be a big deal, but to you it is. So what I would say is, when you're with your husband, don't be afraid to reiterate that, and say it a lot. Don't be afraid to repeat it, maybe repeat it at times when you're not eating, till he gets it, that for you, a little bit of food is not, can be very dangerous, especially if it's the wrong foods and trigger foods, because it could trigger a binge eating episode. So even though his intention might be very good and he thinks like he's sort of letting you off the hook, the results may not be very good. And there has to be a way to keep reinforcing that message. So I would say have strong boundaries and don't be afraid to reinforce that message. And sometimes the best place to reinforce them is not when the episode is happening, but actually, when you're driving or not in the heat of the moment. Or if you're like going out to dinner, to remind someone in the car that this is something you need them to respect about you. So as we come to the conclusion of our webinar today, what I wanted to, again, I hope you can understand that this is such a complex issue. It is individualized for most people. Some people have some of the symptoms, other people don't. But most people who have who struggle with a sense of binge eating disorder have this sense of helplessness around the disorder, and they want to find ways to be able to stop them from doing it. And I feel that one of the most powerful ways is to look at the psychodynamics, the underlying issues of what got you into this place. And a lot of times that's not during the crisis. And this is important to reiterate. It's not during the crisis of the binge eating. When the binge eating has actually happened, you want to pull away from that experience and literally find ways to stop yourself, whether it's picking up a phone and calling someone, removing yourself from the situation. It's not going to be the time when you're in the heat of the act to look at all the deep issues that got you there. It's going to be a time for crisis intervention and just get you out of that crisis. It's like moving you to a safe place and then finding the place, start working through these difficult issues. But I did want to say, as I conclude, that I think there's a lot of hope out there, and the fact that the psychological community now recognizes it as a disorder makes me feel like there's as a disorder that's separate, makes me feel like there's more attention that's going to be paid to it and more research is going to be done. And that gives me a sense of hope that people still see the reality of what people are experiencing. I want to thank everyone for coming to this webinar. I want to remind you that if there's a question that you wanted for me to answer that you didn't get a chance to send in, you can always find us on the Kalili Center Facebook page. You could send me a message that way and I can respond to you. And we want to keep these webinars as alive as we can. Thank you very much. I'm Dr. Howard Gluss.
Good job.